Hello, everybody. This is Dr. Kamel again, and a new content related to the physical therapy license exam preparation. If you didn't attend any of my videos before, my name is Dr. Kamel. I work as associate professor of physical therapy in the United States, and I am a registered licensed physical therapist in the United States, in the UK, and in Egypt as well. I have got my PhD from University of Nottingham in United Kingdom, and I post, and prepare post content and prepare people for the PT license exams in United States, Canada, and Australia. If you are interested, please drop me a message, and I will send you the details about my course. So let's go and see what is the content for today. The content of today is mainly related to ethics, administration, and professional responsibility. And we know that a lot of people sometimes they get these questions wrong, especially with foreign grads who did not take their education within Canada or United States or Australia. Sometimes they get confused about these concepts because they have practiced in a different health system. So let's see what's our question today is about. An older adult patient had a total hip arthroplasty following a hip fracture from a fall in his home. When initially you read the question, you okay, might be an orthopedic question, but let's see. The patient lived alone and was previously able to perform all activities of daily living independently. Here, they telling you what the patient was previously able to do, and also the social situation of the patient, that the patient is living alone and was independent, was able to do activities of daily living. He has been admitted to a skilled nursing facility for rehabilitation. Okay, so the patient had a fall, fracture, and then, total hip arthroplasty, then was admitted for rehabilitation facility or nursing facility for rehabilitation. And now what's happening? They want to discharge this patient back home. Remember, the patient living alone and was independent in activities of daily living. The patient goal is to return home. So again, this is a patient-centered goal. So this is a patient wish actually to go back home. His family believes he should be admitted to a long-term care facility for his own safety after acute rehabilitation is completed. So now we see a contradiction. A patient like to go back to his home, and his family, they don't believe that it will be safe for the patient to go home and live alone, and so on, and they want him to go to a long-term care facility. And we see this situation quite often in with our patients in real life situations. The physical therapist's most appropriate action too. Okay, so what I should do? We always respect the patient wish, but if there are other factors, we will see. Let's go. Number one, advise the family that the patient determine his own discharge environment. So I'm telling the family, okay, I'm not accepting what you are saying. This is the sole decision of the patient, and you don't have the right to talk. Number two, recommend a team conference with the patient and his family to discuss the charge plans. It might be, more wise decision to have this conference so you can discuss the situation with the patient and his family. Number three, schedule a home visit to determine if home modifications are needed before discharge. Yeah, it is a good step, but it might be needed later on. This is not the first thing because we are not sure yet if the patient will be going back home or will be going to a long-term care facility. Implement a treatment plan with a long-term goal of discharge to home. What does this mean? Does this mean that the patient will continue at the rehab facility and you will do a long-term goal or treatment intervention or something like that. So the most reasonable answer is number two. Okay. Recommend a team conference with the patient and his family to discuss discharge plans. Okay. So what is discharge planning? Discharge planning is in advance planning before taking a decision or discharging the patient from the nursing facility or rehabilitation facility. When there is a disagreement between the patient and family, we need, it is a shared interdisciplinary process because everybody, share responsibility. But at the end, we must respect the patient autonomy, safety, and the informed decision making. The patient himself, has a final decision regarding that situation. So I would recommend as a physical therapist a team conference, including in this conference the patient, family, and healthcare team, and we will have discussions about the current patient functional status, safety, risk, support, patient goals, and we will balance at the end depending on the enough information we will get the decision between patient autonomy with the family concern about safety. Okay. Finally, we will align this with the ethical principles and the best practice in discharge planning. So again, the best answer is to recommend this team conference. So this team conference will bring everybody together, and we will have a joint decision for placement of the patient, where the patient will go next. Okay, and this the best time to run this meeting prior to discharge. Okay, because this meeting will be difficult to arrange after discharge, or is the patient back home or going somewhere else. So there is no point in having this meeting anymore. Okay, so allowing the patient to determine his own discharge environment, if there is no safety concern. But, this decision now, if depends on if the patient is competent enough to take decisions or make decisions, okay, or the patient is not competent. Okay, scheduling a home visit or implementation of treatment plan, yes, this is good, but now it is premature because we there is no final decision about where the patient will go next. So the incorrect answer, again, advise the family that the patient should determine his own discharge environment. This is the wrong answer. Yes, we respect the patient autonomy, 100%, but this response is too dismissive. Like you don't care about their safety concern. You don't care about what they are saying. So it is not right, to say that. Schedule a home visit. We said this will be appropriate later on, and now it is a premature thing. Implement a treatment plan with this means that, we this is not about taking a decision or resolve this disagreement, and it will not solve the problem. So as a physical therapist, when we see this conflict of discharge, we need to facilitate communication between patient, healthcare worker, and the family. We need to be always an advocate for the patient involvement, and we use interdisciplinary team approach. Okay, so always choose collaboration, shared decision making over unilateral action or unilateral decision. This is the end for today's question. If you would like to join my physical therapy license exam preparation course, or if you would like also to apply and join the transitional DBT program at University of Montana, or the post-professional DBT program at University of Montana, which is offered at a discounted rate, and it is totally online learning or studying program, please send me a message to any of my WhatsApp numbers 001442248720 or 00201027743702. I will send you the details back of the requirements, the cost, and everything. Thanks for watching me, and please subscribe to the channel and share the channel with your friends, and see you soon in a new content. Thank you.